about offering a new patient special on his website. Now, there is one thing you do want to do on your website. You do want above the fold, you do want a new patient special. And that's the incentive to get them to call. Okay. We're going to cover, the basics of your website and what you should have, but there's a couple things you definitely should have. You should have that offer. And then you should also have an opt-in where you can where you capture their information, their name and email, with regular daily follow-up. Because you'll be surprised how many people will go to your website and leave. Well, if you didn't capture them, they're gone. So when we go into the internet marketing component of the marketing, we'll cover this. But you do want, a unique corner, like the upper right-hand corner, upper left-hand corner, like a star, new patient special. Okay. All right. So the question, Ryan, is what can you do to make that advertisement work more, have it more effective? Okay. So let's walk through the basics of marketing. Okay. So remember, when you look at marketing, what are all the categories that we pay attention to? Well, what's the first category we pay attention to? It's called a target market. Now, I'm going to cover this, even though it's not directly related to a website, because you can't control the target market. But I want to cover it because it's all the big picture when it comes to marketing. So remember, when we talk about a target market, we always are going to want to market to people who have the highest probability of buying the product or service that you offer. That's called a target market. And for some reason, chiropractors don't understand this. They think everybody buys chiropractic. No. And it's the 80-20 principle with every product. There's some people that will never, ever buy chiropractic. And there's some people that the high end, the 3%ers, they really love it. They refer and they go all the time. And then there's all of them in the middle. It's Pareto's principle. It's the 80-20 principle in the market. So what are the segmentations of that? Well, you got demographics. That's who buys. Well, there's certain people that have a higher proclivity of buying than others. And I'm not going to go into the details of that right now. I'm just trying to remind you that this is how you increase or decrease the effectiveness of your marketing. Okay, so there's demographics. Well, you're not going to control that with a website. Then there's psychographics. Well, you won't control that with a website. You will be able to control it with pay-per-click, but a website you won't be able to. So you got demographics, psychographics, geographic radius of draw. You won't be able to control that with a website either. Again, you will if it's paid advertising. And then you got psychographic barriers. Again, you won't be able to control that with a website. Somebody in China will be able to see your website. But remember, when you do any advertising or paid advertising, we pay a lot of attention to this. We don't want it just going to anybody and everybody. Okay, and then you go to what is the gateway? What is the gateway? And this is huge. So what is the absolute best gateway? Well, why do people go to chiropractors? So 84% of the people go to chiropractors. Remember, gateways are the reason people buy a product or service. So in other words, when you start marketing outside of the reason why people buy that product or service, you significantly diminish the effectiveness of your marketing, and you actually hurt the people who would buy. So, and that's a huge problem in the chiropractic profession. Chiropractors don't understand when they advertise asthma, allergy, bedwetting, all those huge paradigm shift subluxation topics. They're not only do you have a little to no likelihood of getting patients from advertising, you're destroying the credibility. And I always give the example of the dentist. If the dentist says he can help you with asthma, do you want to go back to the dentist now for your teeth? You don't even want to go back for your teeth. You think he's a little wacko. That's exactly why chiropractic is stuck at 8% utilization after 120 plus years with a 67% negative name recognition. So the worst thing you could do is advertise non-gateway paradigm shifts. So you got to be real careful about that. And by the way, especially if you're doing personal injury, those attorneys will look at your website when they come into your office, and because they don't want anything to do with that chiropractor. They can't have a chiropractor on the stand in front of a jury talking about how they can help asthma or allergies. Okay. So you got demographic, psychographics, geographic, psychographic barriers, gateway. Now, so what should the gateway be on your advertisement? Well, what's 80? We said 84% become because of back pain, neck pain, headaches of the 8%. So as soon as you go off of that, you seriously decreased your target market. Then there's 7% that come to you for neuromusculoskeletal extremities. 7%. Now remember, we're talking 7% of 8%, not 7% of the population. So guess what happens when you start advertising for a knee or a shoulder? And that's not even 100% of 7%. You advertise a knee, let's say that's 20% or 25% of 7% of 8% confined in a geographic radius of draw. That's why you would never do that. Okay. So you go, and then that takes you to 91%. Out of the 91%, the remaining come to get treated with chiropractic for the somatovisceral problems, asthma, allergy, bandage. So we're talking about 9% of 8%. We're talking about a real small number, and it gets worse than that. You go, well, wait a minute. Out of those 9%, how many of them actually picked chiropractor because they had asthma, allergy, or bedwetting, and they called the chiropractor? It wasn't even 9%. It was only 20% of 9% of 8%. 80% of those 9 people came to the chiropractor for the gateway, back pain, neck pain, headache. And then they heard the chiropractic spiel. In other words, they came through the gateway, the trusted gateway, and then they trusted the person, and it was the trust in the person that got them to get care for their asthma, allergy, or bedwetting, etc. They don't come in for that. That's only 20% of 9% of 8% confined. So you're actually nuts. You know, it'd be like McDonald's advertising, you know, they start selling, I don't know, oil, motor oil, because they keep motor oil, you know, in for, you know, I don't know, one of their cars or something. It's like crazy. The percent, it's not only an unbelievable, ridiculous small percentage, it's a huge paradigm shift, and you destroy credibility. Just like if the dentist advertised he could help asthma by working on the meridians in the teeth. It's like no different. And chiropractors don't get that. Well, they eventually do get it because the market kicks them in the butt. And it's kicked chiropractic profession in the butt for 120 plus years. That's why it's been stuck at 8% for 120 plus years. So you can't violate it. So you go, well, okay, well, what do you put? Well, do you want to put back pain or neck pain? Well, if you put back pain and the person has neck pain, that won't connect to them, right? Or if you put neck pain special and they got back pain, that's a disconnect. So you go, well, what should the ad say that's a target market for the typical chiropractic patient? Well, what's the 3 symptoms they come in for? The top 3 symptoms they come in for is pain, muscle spasms, restricted mobility. That's 80% of why all your patients are coming to you. So the gateway that should be in your advertising should not be back or neck pain. It should be pain relief. Pain relief, muscle spasm reduction, increased mobility, joint mobility. That's what it. So now you're dealing with the back pain and neck pain person, all of them together, and that's the reason they're picking you. So that's the importance of the gateway. So on your website, You do want it to be based on pain, muscle spasms, and restricted mobility. Definitely don't pick a non gateway. Definitely don't do that. And don't pick a gateway, because now you'll limit it to just that gateway. So, but you do want to use the number 1, 2, and 3 reason they go to a chiropractor. So make sure you do that. So that's gateways. And then you go vehicle of delivery. We go into the target market. Next is vehicle of delivery. Well, we're not picking that. It's the website. Okay. And then USB, unique sales position. Remember, there's 5 reasons why people will buy a product or service. Number 1 is always trust. Every industry, period. Okay. Now, after that, the chiropractic industry, 75% is location. 75%. Only 3, and then 15 to 20% is price. And then service is only 3%, and quality is only 3%. So that's why you would never advertise based on service, and why you would never advertise based on quality. It's 75% after a passive or active referral, 75% is location. That's why the number 1 key word on the internet for chiropractor or a brick and mortar business is chiropractor location. That's what they're Googling. That's why. Okay. Okay. So you just need to remember this with your marketing. You can't control a lot of these, but you don't want to violate them with your website. Okay. Then you go to the website. So that's your 7 major target market factors. And then you go to the website and you go, okay, we're going to make it easy to take the next step. And we're going to minimize the obstacles of time or money. So we want to make a robust offer. Well, we talked about making offers before. Okay. So we said, what's a good, robust offer? In other words, we want the offer to sound highly valuable. So if you remember, and I talked about this just a few weeks ago, the components of an offer. Remember, the offer has diagnostics and therapeutics. So those are 2 considerations. And then there's features versus benefits. And which of those categories do the consumers buy with chiropractic? They buy therapeutics more than diagnostics. So if you were only going to offer one, you'd want to offer therapeutics, not diagnostics. But we want to offer both. And then there's the feature versus the benefit. So the feature is like, a neurological examination. That's a feature. Well, we don't buy features. We buy benefits. What's the reason for the neurological exam? That's the benefit. So when you look at diagnostics and therapeutics with the offer, so that this is creating a valuable offer. And what's the offer trying to do? It's trying to minimize the obstacles, the barrier to entry. That's what it's trying to do. Okay. So obviously money is going to be an important component of it. We want to create way tremendous value. And then we also want to take into consideration of time. So that's why we say when we do an offer, it'll be something like this. It'll be like a 9-point new patient special. And it'll be like, it'll be itemized out. It'll be a private consultation with the doctor. Well, that's the feature. What's the benefit? The benefit is to see if chiropractic can help your problem. Number 2, range of motion exam. So now we're going to list like 9 bullets to create value. We're not just going to say exam, $99. We're looking to create value, and we want to stack all this up where it's like, wow, that's a lot. That's what the offer's trying to do. Okay. It's trying to minimize the barrier. So not only are we trying to minimize the barrier to money, but also time or the obstacle. That's what we're trying to do. That's what the offer is about. So then you'd go, what are the basic components? So that's why you wouldn't just say exam, you'd itemize it out. Then you go range of motion test. Well, that's the feature. What's the benefit? Define specifically the restricted motion to apply the appropriate therapy. That's the benefit. Then you do the same with the nerve test. That's the feature. What's the benefit? Nerve test. Find which nerve is causing the pain so you can apply the appropriate therapy that affects that nerve, reduces that painful nerve. See, it's very tit for tat. The benefit is very specific to the feature. It's not generic. Then you go to orthopedic joint test. That's the feature. What's the benefit? Define any painful restricted joints so you can apply the appropriate therapy to relieve the restriction. See, we buy the effects, the benefits. So it's feature, benefit, feature, benefit. Now, if you have x-ray, we put in there x-ray, 2 x-rays if necessary. You always have to put if necessary. That's usually a board issue if you're going to include x-rays. 2 x-rays if necessary to see on the inside what we cannot see on the outside. And then you go to the diagnostics. Now, we always like to at least offer them enough care that they get through the educational sales presentation. What's the educational sales presentation? In chiropractic, it's called patient education. That's what it is. When you're doing patient education, that's a sales presentation. That's what it is. So we prefer to give them enough so when they do come in, they at least make it through the sales presentation, because we know if they make it through the sales presentation, we have a real high likelihood of keeping them as a patient, which is much easier than, you just got them in the first day and then that's it. Well, it's going to take a lot more work now to get them to the next day and the next day, see? So that's why we always like our patient education is spread out over 4 days based on how the consumer buys products and services. So we always like to offer 3 treatments because we'd rather get them through the presentation, especially, if you're pretty good at it. If you keep like 50, 60, 70%, like me, I had a 74% prepay rate. I jokingly say I would do it all for free in the first 3 days because 74% of them were going to buy my big ticket. See? And the big ticket's more important than the first 2 or 3 days. Because if you don't keep them, you not only lose that money, it's like a tree. You're losing all the referrals from that business. You're not just losing that business. You're losing all the potential referrals from that business. So it's huge when you have patients drop out early. It's not just that patient. It's a multiplier effect of loss. And so now you go, that's why we'd offer 3 chiropractic adjustments. That'll get them through the first 4 days. We don't adjust them on the first day. We just do therapy. And then day 2, we'll treat them. Day 3, day 4, see, so it's 3. And then I'll offer like 3 pain relief therapies. And I'll typically say pain relief therapies or even muscle pain relief therapies. A lot of times the patients think their pain is coming from muscles. So I'll see 3 muscle pain relief therapies. Now, they're actually getting 4, but I'm not going to say 4 because now it's incongruent with 3. They're getting 3 adjustments, but 4 therapies. That's incongruent. Although they're going to get 4 because day 1, they get the therapy, day 2 and day 3 and day 4, see? But I don't want it to be incongruent, even though they're going to get 4. I want it to be 3 and 3, okay? All right, so 3 muscle pain relief therapies. And then if you want to add a bonus, now the rule with the offer is by the time you're at this point, they should be perceiving that it's a no-brainer. The bonus is designed to make it a no-brainer. In other words, they should already have agreed to, yeah, by the time you got done with the offer. The bonus, the idea of the bonus is not to get them to take the last jump to go yes. The idea of the bonus is to overwhelm them. In other words, to make it stupid to say no. That's the concept of the bonus. Now, you can have one bonus, two bonus, three bonus. We typically will include one bonus, and it's typically a muscle pain relieving gel, something like that. Okay. You can have something else in there, and you can have two bonuses or three bonuses, and you just stack them. The more you stack, the greater the value of the offer. See? So it's better to stack these things. Even if you had another test or diagnostic or therapeutic you wanted to put in. I just kind of gave you a classic offer. But if you wanted to put in another therapeutic, that's good. And then, and it's always good if it says, 9-point new patient special or 7-point or 8-point. In other words, you're saying there's a lot here. So that's what it would say. It'd be like a 9-point new patient special or 8-point new patient special, and be point. Diagnostics, therapeutics, feature, benefit, you see? And then what we always like to include is the guarantee, right? The guarantee is the risk removal. The guarantee is to make it easy for you to see how chiropractic can help. To make it not make it costly or risk cost, to see if chiropractic can help your particular problem. And we always like to give two guarantees, because the second guarantee, the first guarantee is 100%. There's 100% satisfaction within 72 hours or 100% refund. Now that's done for two reasons. Some of the states have a 72-hour right to rescind law. So it fits perfectly right there to qualify for the state law. But it also is a guarantee reduces risk. That's the purpose of a guarantee. It's to reduce risk. Okay. So you'd put in 100% guarantee and then you would put a time in there within 72 hours or a 100% refund. Okay. That's it. The second guarantee, that when you schedule your appointment, you'll see the doctor within 7 minutes. Because remember, waiting is the number one problem with patients going to a doctor's office. So we're trying to attack the number one problem. That's why in the guarantee, we always put two guarantees. The second one has to do with waiting, trying to minimize the wait obstacle. So when you schedule your appointment, we can get you in within 24 hours, and you'll see the doctor within 7 minutes. See? Okay. Then you go into what's called the price juxtaposition. The normal cost for all of this is, let's say it's $350. Okay. Your cost is only, and I'll go into this a little bit more in just a second, $97. Let's say you're doing 97, 47, 17, 147, 197. Okay. You always have to put why. Remember, if there's a greater than a 20% discount, people get apprehensive. So anytime you do a discount that's greater than 20%, you got to tell them why. So the why is the reason for the deep discount is to make it a low risk proposition, to see how chiropractic can help you, to make it a low risk for spending your time or money. Because remember, that's what we're going after. We're trying to minimize time and money, to make it a low risk offer, a low risk with your time or your money, to see if chiropractic can help your particular problem. That's the why part of the discount. Okay. Now, usually you would also include scarcity, a limited number or a limited time frame. That gets people to act. That's the reason you always have scarcity. Now, you're talking about a website offer. So you can kind of do a pseudo scarcity. And it could say, because you don't want to put in there, it's only good to July 30th. Well, that means you got to go in there and change it all the time. And if it's past July 30th, then it's not valid. Well, you don't want to do that if it's on your website. So you could still put a pseudo scarcity of limited to the first 10 new patients, and with 2 bullet points, limited for the first 10 new patients that call, and it expires at the end of the month. See, I'm going to say end of the month. I'm not going to say the month. It'll say June or July. I'm not going to do that. That way I don't have to change it. That's why I called it a pseudo scarcity. This offer's limited. Now, one other thing you want to consider in the guarantee, and I like this. I actually saw this one time, and I'm actually stealing it. I like it. The third part of a guarantee is that we will not accept your case if we cannot help start to relieve your pain on the first visit. I love that. That's what they want. They want to start relieving pain fast. That's talking right to them. So make that the third part of your guarantee. We will not accept your case if we cannot start, and I'm going to say start to relieve your pain. I'm not going to say relieve your pain. I'm not going to say we're going to relieve it 100%. Don't say that. We're going to, if we feel we cannot start to relieve your pain on the very first visit, that's powerful. They can expect some result. And by the way, they will. Between some therapy in your office or an ice pack at home, they should start feeling better between those two to some degree. Okay. All right. So that's what your website would look like. And it would have all those bullet points. And then it would say, call now. Put your number right there. Call now. Okay. That's how you do that. Now, let me just share with you one other major concept with an offer. So that was a standard offer, right? To get them in and some of the reasoning behind it. There's also what's called, remember, a bridge offer. And I gave the analogy. In other words, it's a really, really easy, no-brainer. Yeah, I'll take that. Okay? But you're still going to have to do work on the other end to pull them through. That's why it's like a bridge offer. So let me give you an example. And this worked really well with a dentist I went to. I showed up to the dentist. I didn't even make an appointment. I said, hey, can you see me? There were 3 people in the waiting room. I said, hey, can you see me? I'm having some tooth pain. And she says, yes. I said, what will it cost? I don't even think I asked what will it cost. I may have, I don't remember. She said, well, we have a new patient special that's only $10, and what it includes is a picture of your tooth and the doctor explaining what the problem is and if he can help. That was fantastic. That was a fantastic bridge offer. Well, guess what the patients want? What's the very first thing the patients want? What's my problem? So it was a very low proposition, very low risk of time and money for me to get answered the number one thing I wanted to know, which was, what is my problem? That's the bridge offer. So you can consider a bridge offer and go, now I'm not going to call it a bridge offer on your website. That's industrial language when I say bridge offer. So you could instead use a bridge offer and go, it's only $10 for a brief exam. Depends on what you want to put in there, the bullets, and the bridge offer would include, consult, and I would include a few bullet points, include a private consultation with the doctor, see if he can help your problem, include a brief exam to see potentially what the problem is. And then if you wanted to include, 2 x-rays, you could. If you didn't, then there you are. But then there's another step. So they would come in with the bridge offer, seeing it'd be something really simple like that, $10, for them to see what the problem is. See, that's another great way. But after the bridge offer, now you got to kick in and go, okay, here's your problem. based on what we found at this point, this is your problem. Then you got to give the recommendations. Now, if you did the bridge offer, now you would offer them the new patient special. So it'd be like bridge offer, new patient special, report of findings, full pay over terms. See, that's how that would work. So, in other words, on day one, we would tell them there wouldn't be a 2-day process. Day one, we do the brief consultation, brief exam. These are brief, by the way. You know, remember, in an exam, there's only 3 things that you definitely need to nail to get the patient to feel secure in the exam. In the consultation, it's what's the chief complaint, what's the intensity, okay, how did it happen, or what ADL is it affecting? That's the bare minimum. If you're going to do a brief exam, that's the bare minimum you can do and get away with it. That's covering what they want. In the exam, it's touching it, check the range of the limited range of motion, and the most positive test, like Kemp's test or foraminal compression. So if you just check the range of motion, did one orthopedic test, palpated it, that would be the bare minimum you could do, and the patient would be satisfied that they would feel comfortable, you know what's going on. Those are the 3 bare minimum, and you need to know that, because you should be doing that when you're busy anyway, and you got 2 or 3 new patients scheduled at the exact same time. Then you spread out over 2 and 3 days all of their intake and the rest of the exam findings you need to do. So that way you can just move them through. You can get them in the process and move them through, and you're done in 7 minutes. And you go to the next new patient, see? That's why it's no problem scheduling 2, 3, 4, 5 new patients at the exact same time. Okay. Anyway, getting back to the bridge offer, that's another consideration that you might want to do is go, hey, bridge offer it's only $10, and it includes private consultation, bullet point, private consultation, a brief exam to see what the problem is, and then the doctor going over with you what the problem is and if he can help. And I would list all 4 of the patient's questions. It would cover what the problem is, if it can be helped, how long is it going to take to feel better, how much is it going to cost. Those are the 4 questions the patient's at that one answered. So that's what the bridge offer. I go, okay, we have a $10 new patient, covers a private consultation with the doctor, 1 bullet, 2, a brief exam. If you wanted to include 2 x-rays in there, you can if you wanted to. And the doctor review with you 4 categories based on that information. He'll be able to tell you what the problem is, if he can help it, how long is it going to take to feel better, what is it going to cost. And you'll know that after an estimate. You should know that after a consultation. Generally speaking, not specifically, but generally speaking. And then, so that would be like a bridge offer. And you're nailing exactly what they want. Low risk, what's my problem, can you help, how long is it going to take? And then I always like, we will not accept your case if the doctor feels he cannot start to relieve your pain on the first visit. That's a fantastic, I mean, you talk about a bridge offer, that's a hell of a bridge offer right there. You're nailing a lot of things that they want. You're dealing with the money and time issue. You're just putting that totally away. Anyway, how it relates to the story, this is what the dentist did with me. It was $10. I said, sure. I go in and they take a picture. They didn't even take an x-ray. It was a picture. You know, they got the machines now that they put the wand in and take a picture. That machine is not needed clinically. They're using that machine for sales to create a visual because they know the importance of a visual. It's not needed clinically at all. So he takes a picture. They get the history. They see it's a chipped tooth. They take a picture. Doctor comes in, says, here, you got the chipped tooth. And then he says, here's your options. What we could do is this, this, and this. We would fill this, or whatever. And it would go, and he goes, it would cost $350. Well, am I okay to pay $350 now? Yeah. He told me what the problem is, and he could help. And he said, we can fix it right now. He just solved all my. Now, if they would have told me when I first walked in, it's $350, I probably would have walked out because nothing was answered yet. None of my main questions were answered. What's my problem and can you help? But because they did the bridge offer and stair-stepped me, that was $350. That was smart as hell what they did. That was called good training, what she did. Anyway, so those are your two offers. One is your regular offer you want to consider, that's robust, all those components. And then the other offer you might want to consider is the robust. Now, remember, when you put the price in, you go, well, what should you offer? What price? Remember, that depends on what strength you're in. If you're in a position of power, you don't make much of a low cost. You don't cut your fees very much at all. But if you're trying to shoot your practice up, or you're trying to jump up quickly another level, or if you just hired an associate doctor and you're trying to fill him quickly, lower it down. Lower it down to get the jump. And then remember the psychographics of money. Never make it the exact amount of the enumeration of the American dollar, $5, $10, $20, $50, or $100. Because as soon as we see 100, you just as soon could have said 147 or 197 because we saw 100. So you would never say, if you were going to charge like 200, you'd never say 200, you'd say 197. That's like you go to the gas pump, it says 19.99. It's 99 cents over 100. See? So it's always just under the demarcation of the psychographics of America. So it's either $17, $47, $97, $147, $197, $247, $297. You get the point. Because as soon as somebody sees 2, just run it up to $247 or $297 because they're seeing 2. But as soon as you said 3, in other words, if you said 3, it wouldn't be smart to stay at 3 because now they're already at 3. So if you're going to be at 3, you might as well go to 347 or 397. Hopefully you get the idea how that works. So that will change. So like I said, if you're wanting to get some patients through, I'd consider the bridge offer to just, make it unbelievably easy for them to pick up the phone and call and come in. But you better be doing those things I said. You better be answering their questions what's my problem? Can you help? How long is it going to take? How much is it going to cost? And if we can't start to relieve the pain on the first day, we won't accept you as a patient. Those are very powerful phrases. That's exactly what they want. Okay. So you may want to consider the bridge offer to get the phone ringing. If you're real low in your practice, you're only seeing 20 visits a week, I'd consider doing that damn bridge offer to get the phone ringing and get them in. And then when you do the mini consultation and you do the mini exam, and we cover how to do that, that helps to establish need. And then you generically answered the basic questions. Then you would give them the next would be the offer. Well, we have an offer we give that includes all of this plus, the x-rays and 3 treatments and three exams, and it's only whatever it is, $97, $197. You see, then you would give the real offer to make it, so it's bridge to real offer. And then of course, once they're at the report of findings, it's all done. Now you've shifted their consciousness, you've established need, and now you're gonna take money and make it affordable with terms, and you're gonna respect their time, and you got the full ticket price of the patient, and you got the referrals. So that's what you want to consider. Consider the bridge offer. Or if you want to take the regular offer and just drop it down, just drop it down to $47 or $17 and then just start from there, and to be honest with you, I'd consider that. If I was seeing 20 visits a week, I want warm bodies. I got to get warm bodies through here. I'd even go down to $17 for the offer that includes all that to get some offer. Because remember, I would do it for free, knowing I got 74% of them that are going to say yes to the big package after the 4th day. See? So I'm thinking big picture, not small picture. So anyway, that's how you would handle the money. These are the considerations you would want to do. But if I was wanting to shoot my practice up, I'm seeing 20 or 30 visits a week. I need to shoot my practice up fast. I need warm bodies, not just to get them to stay, but also to start getting referrals from them. I would just consider giving the whole offer and dropping it down to $19, under the $20 mark. Boom. And then get them to stay. And now they're paying all normal prices with terms over time. And you got a patient and you got all the potential referrals. Because remember, within 30 days, we go after that patient 5 times for referrals for the spouse, kid, mother, father, brother, sister. We're going to get a referral from that patient, 1 or 2 referrals in 30 days.